Hi everyone, my name is Megan Gernhardt and I'm doing my case study on lower back pain. So to get started, I have two definitions of lower back pain, one from the ACSM described as pain, muscle tension, or muscle stiffness localized below the rib margin and above the gluteal folds, kind of pictured below. And then I have one from the CPE, which is pain in the lumbosacral area caused by a variety of somatic dysfunctions. So to break lower back pain down, there's three categories. One being lower back pain potentially associated with specific spinal causes such as cancer, fractures, or infections. The other being local back pain potentially be associated with radiculopathy, which is a disease of the nerve root, or spinal stenosis, which is narrowing of the spinal canal. And the third category is nonspecific lower back pain, which encompasses 85% of all cases. And this is a syndrome with pain and disability, which is the most common symptom. So my next slide is a graph that just shows that 85% again of lower back pain is nonspecific out of the three categories. And then I have a chart that describes ages again, under 30 and above 60 of the percentage of people that do deal with lower back pain. And here you can see that the lowest range is about 41%, so that's still very prevalent to today's population. So, prognosis and possible onset for lower back pain. There is many reasons for lower back pain. One could be from competitive sports because you're constantly compressing your spine. And I have a picture of what a normal disc would look like versus all the different reasons something can happen, such as a degenerative disc or a bulging disc or a herniated disc. And you can see what it looks like. And this is just caused from that constant grinding and compression. And then you have the overload of the spine again, which can cause it, such as wearing a backpack. Think of children doing it their entire life until they get past college. And then many experts do believe that intervertebral discs is the most frequent implication for nonspecific lower back pain, along with injuries and degenerative diseases such as arthritis, disc disease, sciatica, and osteoporosis. You can also have sprains and strains, traumatic injury, spinal stenosis, or even skeletal irregularities that can cause this, along with serious injuries such as infections or tumors or kidney stones, things like that. And then there can be underlying conditions, again, being osteoporosis or inflammatory diseases of the joints, even fibromyalgia can cause lower back pain. So signs and symptoms of lower back pain and the diagnosis. So someone's going to need a complete medical history and physical exam, and here the doctor will ask questions such as, how long have you had lower back pain? What's the intensity? What's the duration? What's the frequency? Have you had it previously? Have you had any limitations to movement? Things like that. From there, they can do a back examination and neurological test to rule out any underlying causes. However, to find and pinpoint that specific cause can be very difficult, so imaging can be done, such as x-rays, computerized tomography, and electrodiagnostics to help pinpoint what is the main cause. So someone with lower back pain, if they've had it already, they're likely to have it again, and recurrent back pain can make the frequency and the intensity even worse, which can be disabling for their job and kind of give them a higher medical cost and just a poorer life in general because they're always focused on this pain. So, epidemiology and pathophysiology. Aside from the three categories, you can either have acute, subacute, and chronic lower back pain. Acute being 2 to 4 weeks typically, some say up to 6 weeks, however most research does say 2 to 4, and here you don't need any interventions or treatment, just rest. Subacute is 6 to 12 weeks, and then chronic is 12 or more weeks, and here functional limitations start to occur because that person now is unable to do their activities of daily living like they used to. So pathophysiology is just pain that is caused by the nerve root being compressed, and it could be from the stimulation of the outer rim of the annulus fibrous vertebral end plate, the anterior dura, the posterior longitudinal ligament. And from there, opinions do vary of possible pathophysiologies, but they could be the anterior and posterior ligaments, or blood vessel walls, or paravertebral muscles, or the list I have on my slide. And this picture just depicts where the sciatic nerve is and another place that can cause lower back pain. So, risk stratifications and factors. It can be age, fitness level, weight gain, obesity, pregnancy, genetics, mental health factors, backpack overload, and even depression all can cause back pain. So that's why it is so hard to pinpoint and why most cases are non-specific. Okay, here we go. So how to reduce the probability of lower back pain. You want to stay active. Bed rest when need, but get out of bed as soon as possible, get going, get to work, and get back to your activities of daily living. You want to continue to exercise. There is this fear and anxiety that exercise will hurt you. However, exercise can only help prevent and lessen this pain. And then therapeutic and aerobic activities along with pain education really helps people overcome this fear and live a healthier, active lifestyle. Medications and heat treatments, massages, and spinal traction also work as well, along with reducing negative thoughts that exercise will hurt them more and that they can't do things because they have lower back pain. This next slide is just a cool slide that shows the some psychosocial factors for long-term disability and work loss associated with lower back pain. Here it pretty much just says that people think that lower back pain is gonna make their life not as great. And it can cause this low morale, this depression. It can cause financial issues and can give a social withdrawal and a negative attitude, which can be disabling for people. So with the proper education and exercise program, they can kind of get over this hurdle and start to live a healthy life. So recommendations for lower back pain. If lower back pain isn't accompanied with a carotid condition, then it is recommended to follow the exercise testing and prescription for a healthy individual. So here you do a cardiorespiratory fitness. It is key to know, however, that because there is this fear in most people with lower back pain, a sub-max test may be better than a max test just because they might not get to that point. However, if the fear is already there, it might not matter. So just make a test that fits their needs specifically and explain what they're doing. For muscle strength and conditioning, again, follow the general population. However, know that these trunk muscles are probably weaker than a healthy individual, so give those cues, modifications, and fit their needs. Flexibility, there is no relationship between flexibility and lower back pain, but follow the general population and that should be good. So treatment. So treatment does depend on the severity of the pain. If somebody has a chronic condition or they notice that there is nerve damage that is getting worse or structural changes, then surgery may be the answer. However, if that's not the case, then there is convenient treatments such as a hot or cold packed activity, strengthening these muscles, doing a physical therapy program, and even medications. So to break down these medications, we have analgesic medications, which are designed to relieve pain. They can be over-the-counter medications such as aspirin, or they can be medications that are prescribed by a physician such as oxycodone and morphine and things like that. Then you have your non-steroidal anti-inflammatory drugs, and here they're just going to relieve the pain and the inflammation, and it can be things such as ibuprofen or the other things I have on this list. You also have your anticonvulsants, which are usually used to treat seizures. However, they do help with pain, so for some individuals this may be good for them. You also have antidepressants, which could be like a norepinephrine reuptake inhibitor, and it's typically prescribed for people with chronic lower back pain. And the last is counter irritants such as creams and sprays and topicals, and here it's going directly to that site that is hurting them or causing this pain, and it's just going to give this warm or cold sensation to dull or lessen this pain. Okay. So now, typical exercise prescriptions and special considerations for lower back pain. You do want to avoid bed rest unless they need it, because this can actually worsen the pain because they're not being active. You want to follow the general population to meet these individuals' needs for testing and combined resistance and aerobic and flexibility exercises. If you have chronic lower back pain, you want to have a tailored supervised program for their needs. And you want to provide trunk coordination, strengthening, and endurance exercises just to strengthen that area and provide assurance that, exercise isn't going to harm them is pretty much the key from this slide. So benefits to exercise. Again, it can increase this muscle strength in their back and help them reduce the pain. It can reduce sickness and increase all the other health benefits that exercise does give. And then the response to exercise is it increases this blood flow and even the nutrients to the soft tissues of the back, and it improves the healing process, reducing the stiffness, which again is key. So just 30 to 40 minutes of aerobic exercise can increase these endorphins, which is a natural pain reliever for people, preventing this pain again. So, exercise conditions and modifications. You want this individual to stretch beforehand so they don't harm themselves, but you want their body to be warm. Tell them not to lift objects that are too heavy to them and how to lift them properly. If they're not physically active, start them at a low to moderate intensity and have them work their way up. And don't let fear stop them from exercising, but don't let them push themselves too hard right away. So for the case study, I have a female. Her name's Marcia. She's a 56-year-old woman. She's actually my mom. And she has chronic lower back pain. She's had it since she's 18. She's had a herniated and bulging disc before. She's been hospitalized. She isn't on any medications currently for her back pain, but she is on other medications to help with cholesterol or acid reflux. And she also has a normal BMI. Her risk stratification is about moderate just because she does have this chronic back pain that causes her to be in bed all day sometimes. And her goal is that she does want to strengthen her core and her back muscles so she can lessen this pain and kind of go about her activities of daily living and walk her dogs without any pain and just to stay fit. And her response to exercise is that when she is consistent, she does feel good. However, she cannot push herself. So for testing, since she is a healthy individual with no other condition, we would just follow the FIT prescription for a healthy individual. For her specifically, I would recommend a modified Bruce protocol, just because she does have this pain, just to get a idea of where her aerobic fitness is so we can fit a program to her specifically. I would also recommend some stretch tests, such as the sit and reach test to get a flexibility in there. I would do some balance testing just because she is, middle age, and this can help her just in general, along with if she does have pain, she can kind of keep that balance if she does feel the need that she's losing it. So I would have her stand on a foam and just kind of close her eyes, put her hands on her hip and one leg up to see how long she would, and then make exercises for her needs. And then I would do a muscular endurance, such as the YMC bench press for her, to get a resistance program in there. For a prescription, again, I would do a moderate to vigorous intensity, such as 3 to 5.9 METs for moderate and 6 or more METs for vigorous. If she was doing moderate, I'd have her do 5 days of aerobic activity or more. For vigorous, 3 days or more, and for a combination, 3 to 5 days. Again, if it's moderate, being 30 to 60 minutes, and vigorous, 20 to 30 minutes. She can even do these in bouts if she does feel slight pain or discomfort. For resistance, I'd have her lift weights for 2 days or more, again, depending on if she wanted to do 40 to 50% her 1RM, or 60 to 80% her 1RM, depending on the intensity. And I'd have her stick to 8 to 10 exercises, 1 to 3 sets for 8 to 12 reps to get that muscular endurance. I would also provide her flexibility and balance 2 days or more, holding these stretches for 30 seconds to 60 seconds. And then I would have some spinal strengthening in there, such as some lumbar extensions. So, the conclusion. Lower back pain truly is a public health problem for the majority of individuals, but with a proper diet, living a healthy lifestyle, and consistent exercise, one can truly ease this pain and go about their activities of daily living. Just like you said, exercise really is medicine, and with a consistent program, lower back pain can definitely be lessened, which is amazing for most people that do have to suffer through it. And last, here is my works cited. Thank you so much. I hope you learned something on lower back pain.